Yes, namaste. Good afternoon, friends. This is Dr. Jyoti Joshi, live from Joshi Panchakarma Clinic, Panvel. So, what is Ayurveda and how Ayurveda helps any human being to have a complete health, I am repeating, a complete health. That is your, physical health. वो तो हर किसी में include होती है, but उसके साथ a complete emotional, social, like all well-being can be achieved when you do a शास्त्रीय पंचकर्मा. बहुत अंतर है जब आप पंचकर्मा ट्रीटमेंट ऑप्ट करते हो या स्पा ऑप्ट करते हो. काफी लोगों को एक गलत फहमी है कि पंचकर्मा करना है मतलब मुझे फुल बॉडी मसाज मिल जाएगा, मुझे अच्छे से स्टीम मिल जाएगा, मेरे को यहाँ पे ऑयल पोर हो जाएगा. काफी लोग ये कंसेप्ट लेके आयुर्वेदा के पास आते हैं, बट अनफॉर्चुनेटली पंचकर्मा ऐसा नहीं है. पंचकर्मा इज नॉट इजी, मतलब एरे गेरे का काम नहीं है पंचकर्म करना. आई एम लिटरली यूजिंग दिस वर्ड बिकॉज इट इज नॉट दैट इजी. ट्रस्ट मी कि मतलब हर कोई ये नहीं कर सकता और पंचकर्म हर किसी पेशेंट के लिए बना भी नहीं है. देयर आर डिफरेंट टाइप ऑफ पंचकर्म. पंच और कर्म 5 टाइप के पंचकर्म होते हैं, जिसमें वमन, विरेचन, बस्ती, नस्य और रक्तमोक्षण. सो रक्तमोक्षण के डिफरेंट टाइप्स हमने देखे. हम लीचेस लगाते हैं, हम सीरावेद करते हैं, मैंने काफी बार उसके लाइव वीडियोस किए हैं. वमन ये वसंत ऋतु में होता है और विरेचन जो है वो शरद ऋतु में होता है और बस्ती है वो बस्ती ट्रीटमेंट वर्षा ऋतु में होता है. आजकल बहुत ऋतु विपर्य या बाकी चीजें चल रही है, बट जहाँ पे कुछ भी काम नहीं करता है, कंजर्वेटिव ट्रीटमेंट हैज लिमिटेड द थिंग्स देयर, दिस पंचकर्मा वर्क लाइक अ मैजिक. बट पंचकर्मा करने के लिए यू नीड गुड सात्म्य, यू नीड गुड बल, दैट इज विल पावर. और वो डॉक्टर ने भी आपको उतना ही काउंसलिंग करके वो चीजें समझानी चाहिए कि पंचकर्म कैसे करना होता है और पंचकर्म में आपको कौन से टाइप की तकलीफ हो सकती है, एंड वंस यू डू विद द पंचकर्म आपको क्या क्या बेनिफिट्स होंगे. सो डेफिनेटली वो पंचकर्म, मतलब जैसे मैं बोलती हूँ शास्त्रीय आयुर्वेद के बारे में लोगों में समझ होनी चाहिए, वैसे सेम पंचकर्म के बारे में भी लोगों में अच्छे से अवेयरनेस आना चाहिए कि व्हाट इज पंचकर्म, कैसे पंचकर्म किया जाता है. पंचकर्म में डिफरेंट जो हम पूर्व कर्म, प्रधान कर्म, पश्चात कर्म, तो ये क्यों किया जाता है, क्यों हम घृतपान देते हैं, क्यों हम मतलब कौन सा मेडिसिन हम कैसे देते हैं, मतलब जो कोष्ठ आयुर्वेदा में बताया गया है, क्रूर कोष्ठ, मध्यम कोष्ठ या फिर मृदु कोष्ठ, उस हिसाब से कैसे मेडिसिन चूज की जाती है. डिसीज मतलब पेशेंट की तकलीफ क्या है, उस हिसाब से हम कैसे मेडिसिन देते हैं. तो जब ये सारी चीजें वही एक्सप्लेन इन अ वेल मैनर, देन ओनली पेशेंट का वो एक्सेप्टेंस टूवर्ड्स होता है. प्लस पंचकर्मा करते वक्त काफी लोगों को लगता है मुझे बहुत अच्छा हैप्पी गो लकी लगेगा. बिल्कुल ऐसे लगता नहीं है. पंचकर्मा करते वक्त बहुत ज्यादा तकलीफ होती है, बट वंस यू डन विथ योर पंचकर्मा यू फील लाइक, मतलब जो फीलिंग कभी लाइफ में आपको पहले फील नहीं हुई थी वो फीलिंग आपको पंचकर्मा दे सकता है. बट पंचकर्मा करते वक्त आपको अच्छा लगेगा, ये मिथ है. सो दैट इज फैक्ट. पंचकर्मा इज कम्प्लीटली डिफरेंट. सो लेट्स लिसन फ्रॉम द पेशेंट जिनका हमने विरेचन कर्म seen with the Basti treatment. Yes, hi. What is your name?
Hi, I'm Soumya Kalyani Sharma.
Where
And
do you stay?
I stay in Ulve, Navi Mumbai.
Hmm.
So recently, yesterday was my 7th day of Panchakarma, and after that I've done with the procedure. Now I feel quite good, but during the procedure it was quite weakening to my body, but it also gave me a lot of difference. I think from the day 2 itself, it showed me a lot of improvement in my gut health. And I think overall my pulse rate, which was quite concerningly high, it went to a very normal level, which according to my doctor was very difficult to do so with just simple medicines, which is very miraculous actually. Also it was definitely difficult but not quite impossible to do. And yes, the defecation and the whole the pain in the stomach and the aches in the body is definitely a long procedure to go through for 7 consecutive days. But overall it's a good procedure, because now that I am on my 8th day after the panchakarma, I feel really good, and I think this would benefit me a lot in the future. Thank you.
What about your psychological health?
I definitely feel a lot better and lighter in a sense. I think physiologically and and the mental health of our body is interconnected. And as I saw my body get better and better during these 7 days, I also felt my mentality improve. I went on a 1 hour and a half an hour yoga procedure in the morning as well, and I felt lighter 7 days back that I did. So yes, the interconnectedness of both the systems felt quite good and improved as well.
What about your sleep pattern?
Sleep pattern was one of the major problems that I felt, and it went like a loop. That today it got disrupted, then the morning got disrupted, and it just went on and on. But during this procedure, also because I was weekend, it let my body sleep better, because weakness lets you do that. And with that, my sleep pattern got a lot better, which was very difficult due to all the stress with examinations and the university. So it's वो है दो तीर से एक निशाना. So it's a good thing for my sleep pattern as well.
Can you please differentiate between quality of the sleep and quantity of the sleep?
Oh yes, definitely. When I was doing my university, just I think 20 days back, 6 to 7 hours or 8 hours of sleep was definitely not enough for me. Even when I was sleeping from 12 to 8 in the morning, still I felt very, very tired, and I had all the under eye bags and different things. But right now, when I sleep at 10 and I wake up at 6 or 7, whatever it is, I definitely feel a lot better. I feel awakened. It quite also be because in Panchakarma, the first medicine that I take is before 7 o'clock, and for that I wake up around 6:30 or 7. So even waking up in the morning, which is compulsory in the procedure, makes a lot of difference. As we all know that waking up earlier definitely affects positively, our mental health is affected positively. So that's one of the major benefits as well.
What about your skin health?
The pus formation in the pimples, it definitely got reduced because all the heat in the body gets defecated. So that's one thing as well that I have noticed in my skin.
Being a common man, not from medical field or not from Ayurveda background, or completely a common man. So when you came here, you came for just treatment, but we did Panchakarma. So what were your expectations when you did the Panchakarma? So Panchakarma, what were your thought process regarding the Panchakarma?
I have been coming, and my parents have been coming to your clinic for a long time. So I quite trusted your words. You said that it would be quite difficult, it would be quite painful. So I expected it. But yes.
No, but before starting the treatment, just studying, listening to Ayurveda, then just reading about Ayurveda.
Yeah. So if I talk about my perception of all these procedures, I thought it would be very easy. And also, like my mother said, we had this conception that Panchakarma is all about massage. It's about definitely more than massage, but we still, we had this closed wall. We had created a closed wall around this procedure, that it is all about massages and it's all about all these herbs that we take, and it's very easy. क्या ही होता होगा, सुबह भी चले जाओ एक दो बार washroom, but it's not that. It is absolutely not that. It's more than that.
Why I ask you this many questions, because there are so many myths about Panchakarma. So we need to create the awareness. There is a lot of difference between the spa and Panchakarma. People consider spa as in Panchakarma, because when you go to any spa, though it's Thai or any other spa, there are they labeled something like Ayurveda, and it is just they are giving massage and everything, but that is not at all Panchakarma. It is just Purva Karma. कुछ भी treatment करते हैं हम, उसके पहले स्नेहन स्वेदन होता है. It's not like that कि that is only Panchakarma. And in Panchakarma, there are different sort of procedure which I have already explained you. Like you underwent the Virechan Karma. So it's massage is just pre-procedure, and that too with different medicated oil और उसका smell. जैसे आपने घी लिया था medicated, so उसका एक अलग ही aroma and all था. But when you go to any spa, they give very scented oils and all. So that is not at all the Ayurveda oils, because Ayurveda don't have ऐसा कोई must scented oil and all. That is not in Ayurveda. Volatile oils are very less used in Ayurveda, because जो भी oil का base होता है वो सीसम oil, तेल से ही हम oils बनाते हैं. So it is more sticky, बहुत ज़्यादा oily होते हैं वो सारी चीज़ें. तो just ऐसे like और ये green grass oil, lemon tree oil, ये सब कुछ Ayurveda में कुछ भी नहीं बताया गया है. It is all with so many herbs and everything.
So the major difference is that I think the other procedures that we go through in the clinics, it's more aesthetically pleasing, and I would say that Ayurveda is definitely aesthetic, but it's aesthetic inside the body and not outside the body.
Exactly. So this awareness is need of our.
Yes, definitely.
Yes, because many a times patient come with that, this we'll get a good massage and everything. So it is very difficult to counsel the patient and first of all make them realize that no, this is the spa and this is Ayurveda. So yes, I think so. How much weight you have lost in last 7 days?
I have lost around 2.5 kgs to 3 kgs.
What about inch loss?
Inch loss I haven't measured, but it is quite visible that I have lost a lot of lower stomach fat. So
yes, thank you so much.
Thank you.
So this is just to create the awareness about what is the panchakarma and why it is needed, that I should speak about what is actually the real panchakarma and what is just spa, because काफी बार लोग spa कर लेते हैं, मतलब they just underwent मस्त वाला massage and all. Many a times I have heard from different people कि उन्होंने हफ्ते में हर हफ्ते हर weekend they do all these things, but yes वो temporary होता है, एक हफ्ता चल जाता है, but it is not like that. The spa and everything is completely different. Whatever the other things, stone से healing करते हैं and all, that is not in Ayurveda. Ayurveda is completely different, and whatever the 5 types of karma are mentioned, so it is in specific ऋतु. लेकिन जैसे अभी ये patient में different, जैसे patient का pulse rate previously last visit 7 days before itself it is above 130. So ऐसे condition में definitely मतलब it is not some cardiac pathology. We have ruled out the thyroid and other stuff. So if nothing is there, then definitely I need to go for the जहाँ पे हम complete detox treatment, that sort of treatment we can do. So definitely I opt that rather than just doing conservative treatment, just giving medicines, it is not it will not work, because 130 pulse rate, that much of tachycardia is not good. It can be fatal as well. So ऐसे इसमें पंचकर्म करना, you need to take daily follow up from the patient, that how the patient is doing, patient ने कैसे medicines लिए है, previously the dose was different, afterwards I have increased the dose gradually of the medicines as well. Every day you need to take proper follow up of the patient and everything. So panchakarma is something like it is completely different, and whenever you do panchakarma, उसके बाद जो effects होते हैं आपके body पे, it will be long lasting. It will not be a terminal just temporary effect. It will be a long lasting effect. But panchakarma करना, ये वापस मैं बोलूंगी, it's not easy for doctor as well and for patient as well, because you need to give your complete attention to that single patient on everyday basis, because every day you cannot call the patient to just for the follow up and everything, but every day you need to connect it morning and evening at least with the patient, like patient is admitted like in a hospital. So these are the things and these are the panchakarma, and uski jo benefits hai, that is something we cannot explain, that can only be experienced when you underwent the panchakarma treatment. So it's all about Virechan karma. So I will conclude with that. Please do take care. Namaste.